very good afternoon. I am Dr. Shubham Vatsya and I am a senior consultant gastroenterologist. I work in New Delhi. I'm working with Fortis Hospital Vasant Kunj at present, and I am director of gastroenterology here. And today I'll be talking about a very common problem which our patients face, which is called the post-meal reflux. It basically means that when you have a meal or when you eat your food, around within half an hour to 1 hour of having food, you have severe burning in the middle of your chest, behind the chest bone, which is called the sternum. And this is mainly due to a dysfunction in your lower esophageal sphincter. So a lower esophageal sphincter is an anatomical structure which is found at the junction of the food pipe, which is called the esophagus, and the stomach. The function of this sphincter is to allow one-way traffic of food, water and air from the food pipe into the stomach and not allow it to come back. But patients who feel a lot of acid and food coming back into their food pipe, who feel burning because the food pipe is not used to that acidity and that acid exposure, that is the problem of post-meal reflux. And we have these patients who have a lot of burps sometimes, a lot of burning, a lot of discomfort in their chest as soon as they have food, because of which the food intake decreases and their discomfort keeps increasing. So this is the problem of post-meal reflux. So basically, whatever treatments we have, what is the problem with reflux? The problem with reflux is the acid. So what happens is that the acid is a natural substance which is present in the stomach, and it is required for a lot of functions of the body, particularly for digestion. But other than the stomach, the food pipe is not used to that acid. So the acid is not a problem. The acid at the wrong place is the problem. So we have two kinds of treatment. One is the drugs which are called proton pump inhibitors and H2 receptor antagonists. These are the ones which break down the acid and they make it basic so that when the reflux happens, it is not acid. On the other hand, we have these barrier compounds. The primary compound used in this today is sodium alginate. So sodium alginate, what it does is it goes into the stomach and creates a raft above the food and the acid. So it creates a layer in the stomach above the food and the acid. So when that reflux happens, the acid does not come in touch with the food pipe, but the sodium alginate raft or the film of sodium alginate which is formed above the gastric contents, that is what prevents the injury. Rather, it helps as a barrier function where it prevents the acid from coming in touch with the esophageal lining.